Cancer is a well-known disease because it affects so many people. According to the National Cancer Institute, in 2020, it was estimated that there would be 1.8 million new cases in the U.S. alone. Cancer is a leading cause of death in the world, with breast cancer being one of the most common, with 2.26 million cases, according to the World Health Organization. According to American Cancer Society, breast cancer is a type of cancer mainly found in women. However, men can develop it too. It is found in the breast area or under the armpit. This is oftentimes found as a lump or in an X-ray. It is important to keep in mind that not everyone has all the same symptoms, and that if you have any of these symptoms, it is important to contact a doctor or connect with a doctor. According to the CDC, the symptoms are as follows: new lump in or around the breast, swelling in part of breast, dimpling on part of the breast skin, redness and or flaky skin in the nipple area, nipple discharge including blood but not including breast milk, any change in the size or shape of breasts, pain in breast or breast area. It is also important to state that not everyone shows symptoms or signs. This is why mammograms are so important. I'm going to touch upon the specifics of mammograms later in this video. For now, let's discuss risk factors. Despite breast cancer being so common, it is so complex that the exact causes are still unknown. Sadly, some of the risk factors are out of our control, so we're going to discuss these first. The risk factors out of our control are as followed. According to the CDC, main factors include being a woman and getting older. This is something that happens in every woman's life. With others being the family history of breast or ovarian cancer, starting menstruation before 12, and going into menopause after the age of 55. This is because your body is exposed to hormones for a longer period of time. And lastly, genetic mutations BRCA1 and BRCA2. On the brighter side, according to the CDC, here are some risk factors you can change: not getting enough physical activity, being obese after menopause, or taking hormones like estrogen that are oftentimes found in select menopause medicine and birth control pills. What is a mammogram? By definition, it is an X-ray of the breast used for early detection of breast cancer. Since the direct cause of breast cancer is unknown, the CDC says that regular mammograms are the best test doctors have to find breast cancer early. This is why regular mammograms are so important. Now, you may be wondering when you should begin regular mammograms. The standards set by the American Cancer Society are as follows. Women ages 40 to 44 have the option to start annual mammograms. Women ages 45 to 54 are recommended annual mammograms. And women 55 and older should switch to mammograms every other year, but of course they still have the option to continue with annual mammograms. Once diagnosed with breast cancer, what are your options? Once again, according to the CDC, breast cancer treatments are as follows. Surgery that is used to cut out cancerous tissue. This is often the treatment for stage 1 breast cancer. A second option being chemotherapy. This form of therapy uses medicine in the form of a pill and or injection to shrink and kill cancer cells. A third option is hormonal therapy. This stops the cells from getting hormones it uses to grow. And a fourth option being radiation therapy. This uses high energy rays to kill cancerous cells. The earlier stage of breast cancer that one is diagnosed with, the better the survival rate. The treatment is also normally less intense according to the Susan B. Komen Foundation. The survival rate for stage 1 breast cancer is 98 to 100%. This is why I am once again going to emphasize the importance of regular annual mammograms. Now, this was a lot of information, all of which is important for your future health. If you would like to learn more about breast cancer and stay up to date, you can always visit the CDC's website at cdc.gov or the American Cancer Society at cancer.org.